Good afternoon, everyone. Thank you for coming. So as usual, I have a lot to talk about and not enough time, so I'll get through as much as I can. I tried to get a pharmacist to come today to help with this presentation because I thought it would be helpful just to talk about general medication interactions, how to avoid them, some devices for keeping track of your medications and so forth. So I'll try to give you a little bit of that information, as well as just kind of a general overview of some of the medications you might be taking with Parkinson's. So a couple of things before we get started. One is we are videotaping this presentation, so it will be up on our website for future reference. So if you miss something that I say, you can always look at it later. Also, because we are videotaping, please turn off all of your phones and put your medication reminders on vibrate and all that sort of thing, so that we don't have interference with the recording. Also, when you're asking questions, keep in mind that I cannot answer individual questions like, my doctor put me on this medicine and this medicine, should I be taking those? Okay? I can't answer questions like that. I can answer general questions about what's this medicine used for, what are some of the side effects, and that sort of thing, but I cannot answer like, should I be on this medicine? Even if you're my patient, I probably won't remember what you're on without your chart anyway, so try to avoid asking me that kind of personal, my medication questions. Also questions like, if my dog ate my Cinemat, what's going to happen to my dog? I have no idea. That's literally a question I got when I was on call, and I said, well, you have to ask the veterinarian, and they said, we did, but he said to call you. So I don't know what this medicine does to dogs or cats. I have no idea. And then I got one, my mom took my dad's Cinemat, what's going to happen to my mom? And, so try not to feed your medicine to anybody else is a good overall principle on the whole. So I'm going to show you a couple of things, little helper things. One is this book on Parkinson's medications from the National Parkinsons Foundation, and I think we have some of them up here if you don't have a copy at home. This is a just general book that the National Parkinsons Foundation puts out as part of their so-called Rainbow series, and you can get this book and their other books by calling their 800 number or looking on their website. And I happen to do a little bit of writing in this one on the complementary medicine section, so it's pretty good. It needs to be updated again because I don't think it has rasagiline in there, which is Azilect. So a couple things are missing from here, but it's a kind of a good general book about what do the Parkinson's medicines do. That's kind of a basic resource. Then the other thing I have, if you don't already have one, there's this card, Medical Alert. I have Parkinson's disease, and in the tiniest type you can possibly imagine is a list of medicines that should not be given to people with Parkinson's disease or should be given very cautiously. I think that they should hand this out with a little magnifying glass myself, but in tiny, tiny type. So it's very helpful to have something like this in your wallet along with the list of your medications that you're taking, and everybody should have this at all times in case you go to a hospital so they know that there are certain things you should not be getting. And you can get these, we have a few of them, and then you can also get these from the National Parkinson's Foundation as well. It also says, I am not intoxicated. So if you drive while drinking, keep in mind that you'll be telling a falsehood if you pull out this card. Right? We don't advise that. We also have, now there's this nifty thing from the National Parkinson's Foundation that is a kit that the purpose of it is if a Parkinson's patient has to go in the hospital. And I believe they're still giving these out free of charge as well. I think you can order them on the website or by the 800 number. And what this has, it has a bunch of different gizmos and reminders. The main point being that people that have Parkinson's disease and go into the hospital, my number one complaint that I get from those people is they didn't give me my medicines on time. And this is a big problem for people with Parkinson's disease who have a very brisk response to their medication, but who otherwise are having a lot of trouble moving. Getting in the hospital and having some nurse say, oh, I have a 4-hour window to give you that medicine. Has anyone experienced that? It drives people crazy, and it causes a lot of problems. It can be dangerous because some people with Parkinson's could fall down, or have trouble swallowing or something if they don't get their medicine on time. So it's really important. So this has a variety of different things to kind of remind people. It's called Aware and Care. So this is something, again, you can get from the National Parkinson's Foundation, and I'll have it up here in case anyone wants to take a look at it. But it's just basically a kit for communicating with your providers in the hospital so that they know how important it is to get the medication on a regular basis. Okay, so I think that's it for my little helpers. One of the things you need to know with the Parkinson's medicine in particular, and really with all of your medicines, is what does this medicine do for you? All right? So constantly with Parkinson's, people come in and say, or call up and say, my foot is twitching, or I have a pain in my shoulder. And the next question we are always, always going to ask as Parkinson's specialists, does anyone know what the question is? What meds are you taking, and does this symptom happen when your medicine's working or when your medicine's not working? Now, not everybody with Parkinson's has a clear-cut response to their medications, but some people have what's called motor fluctuations, meaning sometimes the medicine's working and sometimes it wears off, especially between doses. Some of these symptoms like twitching or tremor or muscle spasms or anxiety or a whole bunch of symptoms that can happen sometimes as a side effect of medicine or sometimes when the medicine's wearing off. So always, always, before you call up and say, I'm having this symptom XYZ, stop and think to yourself, it seems like this is mostly happening an hour after I take my medicine, or during the night when I haven't taken the medicine for a long time, or, oh yeah, that's right, it happens when I forget my noon dose, and by 1 or 2 o'clock I'm having this symptom, because otherwise we can't really do anything to fix it. So if it's because of too much medicine and we give you more medicine, that's just going to make it worse. And if it's because your medicine is wearing off and we think it's because the medication is causing a side effect, we're going to give you too little. So we really need your guidance. So that's always the first thing. And sometimes it makes note it's not related to the Parkinson's. So it's the same. It might be from your arthritis or something. So it may not be related to the medication ebbing and flowing. But that's always the first thing that you want to stop and think. Is this getting better when I take my medicine or worse? Okay? All right, so I'm going to just talk about some, first of all, have everybody been to the Institute before? Anybody not been here before? Oh, okay, so there are a few people that are new. So I'll just quickly run through what we do here. We have, in addition to our multidisciplinary clinic, and multidisciplinary means not just doctors treating you, but we have very educated nurses. We have a clinical trials program. We have a brand new physical therapist, Teresa Najar. Could you stand up back there so everybody sees? This is her first day. She's a physical therapist who specializes in Parkinson's, and we're very fortunate to have her joining our team. We have personal trainers who have learned about Parkinson's, and they teach some of our classes. We have a dance instructor who some of you may know, who's teaching a dance class here for Parkinson's patients. We have a very good speech therapist, Randy Hoffman, who does speech therapy specialized to Parkinson's and runs a choir and a speaking group for people who need to practice their speaking and singing skills. Am I forgetting it? We have a social worker, unfortunately only part-time, who has led some stress management groups here and has helped people find information about home care and long-term care facilities. So that's our multidisciplinary team. We do clinical trials, so we're constantly doing tests of new drugs and therapies for Parkinson's in the clinic. I think we had an all-time high of 25 studies going on last winter. They're down a little bit now. They tend to kind of go up and down. This is how we get new drugs and treatments on the market for Parkinson's. So if you haven't participated in a clinical trial, you might want to consider checking that out, because it's a very satisfying thing, and patients find that it's a way of feeling psychologically like they're striking back against the disease. We have a Parkinson's genetics program that's fascinating. Dr. Shuley runs that, and she's doing a really interesting project with stem cells where she has taken skin cells from people with Parkinson's, with some kinds of Parkinson's, and now she has a model of Parkinson's in a petri dish. Becky, is Becky here? I think Becky's probably going to be doing a tour later, you know? usually she does a tour after these things, so she can tell you some more information about that program. We have other kinds of basic science research here, and we have a wonderful epidemiology department, which is looking at why people get Parkinson's, why some people get it and other people don't. They're doing that all over the world: China, Alaska, Hawaii, the Midwest. So when you have a question like, gee, does pesticide exposure increase the risk, somebody's risk for Parkinson's, or solvents or something like that, chances are this department here, which is really world famous, led by Dr. Tanner, has done the major portion of the research with that. And then we have other basic science projects here as well. So there are a lot of things going on, and you can learn more about that if you take the tour. So that's the Institute, all here under one roof. So Parkinson's disease was described in 1817 by a doctor named James Parkinson. And if you ever see a picture of him, you will know that it's phony, because there aren't any pictures in existence of Dr. Parkinson. He did a really good job of describing Parkinson's symptoms that still we turn to over and over again as we focus on other aspects of the disease. It's primarily caused by a progressive loss of dopamine cells in the brain, although we've learned over the years that there are a lot of other things going on as well. This is a cartoon of the dopamine neuron. So what this means is that if we could look really close up at the end of the neuron here, we would see that the whole point of the dopamine is to go across this gap between cells to communicate with the next cell in line. And so when you don't have enough dopamine, we have to come up with some other way to do that, either by giving another drug that keeps your dopamine from being broken down, or by putting dopamine back in the form of levodopa, or by stimulating the receptors with a dopamine agonist drug like Mirapex or Requip. So all what we're trying to do involves making that connection between those two cells work better. The motor symptoms of Parkinson's tend to be tremor, slowness of movement, stiffness or rigidity, and then later on in the disease, balance impairment, and then masking of the facial features often goes along with that. Secondary symptoms include stooped posture, small steps, small handwriting, asymmetry, so one side's usually worse than the other at the beginning, and again, the reduced facial expressiveness. Now, not everybody's going to have every symptom I mentioned. Some people will get them later, some people won't get them at all. So don't think that just because I list something here today, you're definitely going to have that, because that's not. Everybody's different. Has anyone ever met anybody with Parkinson's where their Parkinson's was exactly like yours? Yeah, I've never seen it happen in 20 years. So everybody's different.